you, Sherry, for that great history about where things are. Sherry is not only a part of starting this, but many of you don't know that she's also a clothing designer. She designed that she wore. So if you're interested in
some T-shirts.
Yeah, well, we've got T-shirts for the rest of us. Alongside. But anyway, thanks for coming. Appreciate it and welcome to this. I'd like to know just where people are from, in terms of regions, Do we have anybody from Western Mass here? Or, okay, we've got Western Mass. How about Northeast Mass? Any Northeast Mass folks? We've got a few Northeast Mass, all right. Southeast, some Southeast to Southeast is here. That's great. What about Boston, the Boston area? We've got Boston, and what about Metro Boston, which we include here? Okay, good.
There's also a Central Mass, Mike, by the way. Which is where we're at right now. Actually, we're at Metro.
Is Metro, right?
There is a Central.
No, there is a Central Mass, and we've got the British. Central Mass? American? Right, okay, great. I thought so. Well, thank you. And for those of you who are in New York, Connecticut, Rhode Island, thanks for coming, and we'll talk about expansion later. But here's what I wanted to do. First, I'll let you know that I think Sherry already told you, but if you go to the left and to the right of you, there are about 9,000 other people that are just like you that are part of this. And so this is just a small part of what we're about. And we're going to, and before this is all over, with your help, we're going to multiply it and double that to 20,000. And numbers matter, right? Numbers really do matter in the world. People count and they want to know, well, who's behind this? Who's supporting this? And it's not just folks who are working in the sector. It's people that are providing management supervision, and people on the side who are receiving services. There are people that are just volunteering, that are board members. No matter where you look, everybody, including legislators, including all of our elected officials, are all part of what we call a caring force. And we want to make this the thing that everybody realizes is important for this sector, because far too often human services has not been really identified very well. Why? We don't know. 1 out of 10 of our state residents have some connection with that. And you know as much as I do how important we are to our overall society and to the growth of the Commonwealth. So we're going to change that. No, you're going to change that. And we're going to talk a little bit more about that. Now, my task is to quickly go through the budget and the legislative, and I'll try not to make it so dry and boring that sometimes numbers can be. So I have to ask you, if I give you a number, you have to think of a face, all right? So, okay, is that okay? So you got to think of, how does this number help somebody, all right? Is that the best thing I can do for you, okay? All right, so why don't we start with, we know that the governor this year has done something that's really unprecedented. He put in his budget about $140 million to support programs and services through Chapter 257. Now, you might pause and say, well, what's Chapter 257? Well, it's the rate reform law that many of the people here in this room worked with the legislature and the administration to get through. And what that is about changing the way they purchase the services. Far too often, the way services were being purchased, any number can kind of work. It works its way in. And what happens is that, unfortunately, there was never enough money to adequately fund the services that we all care about. So who took it on the chin, unfortunately, are the people that are working here, because there wasn't enough money to really provide the kind of salaries and really provide the kind of health insurance and really provide the kind of services that we want to provide folks. So that's been an effort that's been going on for quite a long time to make that happen in 2008, and we're seeing changes. Now the goal is, rather than have a salary reserve, which we're asking for, ultimately, we just want you to get rates, because salaries alone aren't the only issue here. Because if you get a salary increase, then your health insurance jumps up, right? And many of you know that your Social Security can jump up, right? Payroll deduction. So we know that we really got to really look at this and make this a really meaningful budget. And the way to do that, we've got to look at not just salaries, which are important, very important, but the whole thing that involves in contracting services. So that's part of what Chapter 257 is about. How do we provide services so that clients aren't sacrificing the services they need? We get adequately funded. We're not going to get rich in this business, but we can at least expect to get adequately funded. And that's what we're trying to do to help folks here today. But we are asking for a salary reserve for those who are not covered under 257. Some people are, and they should be getting and will be getting some rate increases based on that. but there are going to be a number of people that are not going to get that. And so the council is working on putting together a package for a salary reserve that we're going to ask to help out those folks who are not part of that. Because you could be working side by somebody who gets it and somebody who doesn't get it. Not fair. We want to make sure that all votes rise. That's the way we think this is going to work. Everybody can get what's fair to them. So we're going to be doing something to that effect, and we're going to come up with a package that's going to help to do that as well. We also put together a legislative agenda. And by the way, there is a fact sheet that some of you don't have. I don't know if everybody has that. Has a list of what's on our legislative agenda. We call it a pro-workforce legislative agenda because we're working with three things that we think is going to really help. First, health insurance. No surprise. Anybody here thinks they're not paying enough for health insurance? Okay, I was surprised by that. Are you not? As hard as the CEOs and the managers in your program really try hard. Yeah, go right ahead. Really try hard. It's really an unfair situation with health insurance here. Now, it's great that health insurance is accessible in Massachusetts. We all applaud that. It's great. But it's not so great when you can't afford it, right? And so part of what the council's been working on about, how do we address that? So we've got a couple of ideas. First idea is to try to get us eligible, us being in the service, eligible for the group insurance commission. And if we can get our services and our health insurance under there, we think that's a way of bringing down the cost. We know that it works well for states. You know, a lot of the cities and towns around trying to do that. We're saying, what about us? We're all here at the same, we've all got the same kind of health issues as everyone else, and so certainly using the same providers that everyone else is using. And here's the kicker that we're saying to the state. Guess what? State, you're reimbursing all these health insurance costs that we have to pay through our organization. So get this, if we can get that lower, then you don't have to pay as much, and we can have that money go to services. Isn't that what it's really all about? So that's an important part of that. The other piece, we've got seats somewhere, don't we? Don't we all? Yeah. Oh, the seats are coming with them, okay. Bring your own chair. Now, we also got an aggregator law that we're looking to do that will allow us to get together as human services organizations and try to put our own package together. So that's another way that we're trying to address that cost. And we think if we can do something with health insurance, that keeps more money in your pocket. The second thing is tuition remission. People here familiar with tuition remission? Raise your hands if you know something about that. Yeah? Okay. This has been a program we started over 10 years ago, which really allows, councils put together that really allows people who are interested in undergraduate education to get that without having to pay tuition, as long as they're using one of the public schools and universities. It's worked well in that respect. You still got to pay fees, right? Still got to pay for books, which is no cheap and inexpensive matter. We get that. But it helps that somebody at least is covering the tuition part. We want to expand that to the graduate school level. Why? And continuing ed? Because our jobs are getting more complicated. It's no longer just to have a bachelor's to do it. There are some parts of our field in which you really do need to have a master's degree in order to get credentials and do the work. So why not allow us to develop? So we're interested in not only in helping you develop economically, but also develop where it's going to really make a significant difference in the quality of care that you're providing folks. So we're doing the tuition remission. And for those who, in fact, may be in a graduate program that's not part of the public schools and still got loans to pay, we're interested in coming together on loan repayment because we think if you're willing to work in this field, which we know generally is low paid, why can't we help you with your education? We know that is needed. We know that that's an important thing. So we're asking the state to think about how they can do that. And by the way, that's the only one of the bills that we're proposing right now that's going to need a straight state allocation. We're asking for $3 million for that. But we're not asking for any money for the health insurance. We think they can do that without money. We also think we can do the tuition remission without money. And the other one we're asking for is social enterprise expansion of that, as some of you are involved in. In fact, the people that created these great cookies here, community work services, or the kind of shop that we have at Mercantile at New Path. We can help expand those businesses. Not only does it provide money into the programs, but it also does something in helping people to learn skills and learn jobs and create the workforce. So that's one of the things we're trying to get to. Now, Having said all of that, there's a picture up there of a familiar face. Some of you may know that person. Let me share with you who that is. When we started, when we started the salary reserve is a big number, right? Came up last year, we asked for about 28 million, we got to 20 million. We know it's a big number. We know that it's important for us to do that. But even though there may be some that think we aren't important, we know that there are people in the legislature that really do think we are important, and active all the day. And all the way to the top, and those in deference to the representative in the House. But if we were to go to the Senate President, for example, and ask her what her priorities are, she was very clear. Senator Murray was very clear that her #1 priority was trying to take care of the caring force. Now, I happened to be there during the holidays, visiting and walking through, and that might have been the time when the governor kind of was threatening a 9C cut of the salary reserve. And I was hoping he would go by the Senate President's office while he was there to express, because he would have seen the most beautiful bear in the world underneath her tree. And you know what that bear was wearing? Best looking bear ever. And that bear and that t-shirt, let me tell you, was the kind of thing that she brought in there with the governor's office at a meeting with him, and lo and behold, that bear didn't even speak a word, said volumes about how important it is to support this. And I said to myself at that point, we got 10,000 people who really speak. Wow, what difference we can make in how this state is running, and how we can really make a difference. And so that's what I'm looking at when I look at people out there and do that. And so another person has been a key leader for us in there, and it's Representative David Linsky. By the way, we happen to be in his district.
Actually, you're not.
I'm not?
You're in Santa Candros right now, but that's okay.
Oh.
Yeah, but we're parked in yours.
Gosh, is that Santa Candro, the borderlines? We'll have to do that. But anyway, Representative Linsky is the 5th Middlesex district, and that represents the town of Natick, Sherburne, and Millis. He was first elected in 1999. Serves as the chairman of House Post Audit and Oversight and the chair of the Joint Committee on Federal Stimulus Oversight. Clearly, he is important because he's part of the leadership in the House, and that's important to have that kind of champion. And he's been a champion for human services beyond the salary reserve and the things that we care about. You know, when we did our rally there was only a few people that we felt deserving of the Caring Bear Award. And Representative Linsky, as you can see, clutching right on, so that no one would take it from him, defended that caring bear and received that. And we're proud of what he's been able to do for us, and that he's also a practicing attorney and a lifelong Natick resident, but we can consider him a friend of the human services sector. So we asked Representative Linsky if he would just share a few words with us about what does all of this mean? Does this make a difference?
Thanks, Mike.